What does it mean to be a young survivor with a rare cancer? Or facing a disease that seems to defy the boundaries of age, despite what your doctors may say? Hi, and welcome to Kidney Cancer Unfiltered, the podcast by the Kidney Cancer Association, diving deep into the raw stories of kidney cancer patients and survivors. I am Anna Maria Scaccia, your guide through the real, unfiltered experiences that often go untold. Today, we are joined by Melissa Helmick, a young cancer survivor who continues to grapple with the unknown. Dismissed by providers who labeled kidney cancer as an old person's disease, Melissa has felt the weight of isolation and uncertainty. In our conversation, we'll go through her journey of finding resilience, connecting with fellow young adult survivors, and embracing the mantra, prepare for the worst, hope for the best. Join us as we peel back the layers of a story that goes beyond individual struggles, shedding light on the challenges faced by many young cancer survivors and what representation can do to change the experience. Well, thank you, Melissa, for joining me. While I may know you very well because we're very close friends, why don't you tell our listeners more about yourself and your story?
My tumor was found for chromophobe renal cell carcinoma in 2020, just on like a routine looking for a hernia type of thing. I am a mom of 3. Actually, it was my youngest that helped me find the tumor. And I have a husband and I'm a photographer.
Well, thank you for joining me and telling us more about yourself. So for everyone listening, talk more about like your experience finding this tumor, kind of the emotions you went through, especially being young, right? Like being so young,
Yeah.
having this tumor, being a mom, all that fun stuff. And fun's a relative word. Talk us all through it.
So I was relatively healthy, I guess. I was, so 2020, that would have put me at 27. Yeah, it was just before my 28th birthday. So I had just had a baby, my 3rd child, and he was a large baby, and I'm a generally tiny person. And so I was pretty sure that he gave me a hernia and I wanted to start like working out, get in shape. And so I went to my doctor and I was like, hey, I'm pretty sure that I have a hernia. Can we like check on this? So I went for a CT and they were like, hey, there's also some sort of something on your kidney. And I'm like, oh, okay. So that kind of like threw me because I was like nothing's ever come up on any of my imaging stuff before. Like, what the heck? And like, I don't know if other people did this, but I was always one of those like, when you're in the shower and you're young and you get all this hair that's coming out and you're like, oh my God, I definitely have cancer. And then you realize, no, you're being silly. You definitely don't have cancer. So then like all of that came through my head. I'm like, what if I like jinxed myself and I do have cancer or something? But they were like, no, it's probably fine. It's probably just, like a simple cyst, no big deal. So they wanted me to go for like a more in-depth scan. So I did that, I want to say like a few weeks later. And they were like, hey, we want to watch this. We don't think it's anything concerning, but we need to see if it continues to get bigger. So in 6 months, we want you to come back and have another one. And I was like, oh, all right. And then like in the back of my head, it was kind of like I was freshly postpartum. Like I was only, he wasn't even a year old. So he was like maybe 6 months, give or take. And then like with the other 2 kids, and then like now you're talking about the pandemic, so I was like, oh, okay. So I was like, well, no sense in freaking out about it now. I still have 6 months. Like it's as if it grows. And, of course, everybody was like, oh, it's nothing. It's definitely nothing. Like you're healthy. You're fine. Like, do you have any pain? Or I'm like, no, I feel fine. So then when I went in for that scan, it was my primary doctor. And she was like, hey, so this is out of my hands now. She's like, you need to go see this urologist. And I'm like, why is it out of your hands? I don't like that. And she was just like, it did get bigger, but I can't do anything about it. You probably should have it removed. And so when I got to so she gave me the printout of what the results of the CT were. And because for those that don't know me, I'm neurodivergent and just found out almost a year ago that I'm autistic. And then 2 or 3 years ago that I also have ADHD. And because of that, and physicians that just dismissed me, I was like, she didn't read all this stuff on here. What does all this stuff mean? So I did what I do best, and I researched. And it said, all I remember was it said, oh my gosh, it was that one specific type of category. Oh, the Bosniak. It was like a Bosniak level 3, maybe a 4. And it had been a 2F. And I was like, well, what's all that supposed to mean? So I Googled it, and that was when it was like, oh, well, now it's a 50 to 60% minimum that it's cancer. And I was like, oh yeah, it's definitely cancer. It for sure.
Yeah.
Like, you know. And then of course, again, everybody was like, no, it's not. You're just worrying. Like, you still have 50% that it's not. And so I went and saw this doctor, and he's like, you're so young. He's like, this is an old man's disease. He's like, I highly doubt that it's cancer. And I'm like, oh, cool. So we're just going to take it out. And like, I had wanted it out anyway, because my thinking was, even if it's benign, like if it got bigger, eventually it's going to like impact my kidney function. So I was like, let's just get it out, you know? And then after it came out, that was when they said, and it was really, you know, fun time, using that fun word again. It was a really fun time because it was during COVID. I was not allowed to bring my husband into my appointment with me. And they told me by myself, and it was the PA. I have never seen my surgeon since surgery. And all she told me was, so it was cancer. She's like, it's a rare cancer, and you're going to have scans and blood work and stuff. And that's about it. And I was like, oh, okay. And I threw up when she told me, because like, I kind of thought that if I told myself this whole time that like, if it was cancer, that I'd be prepared for them to tell me. But turns out that it doesn't prepare you at all for when they actually say it. And I just remember my husband and I, we went out to dinner, and I remember drinking a beer because I was like, let's celebrate. I don't have cancer anymore. And then I didn't realize that after that, and like in the van on the way to the restaurant, I was trying to like research about this type that they told me it was. And I found literally like 5 or 6 pages that just regurgitated the same 3 sentences about it. And I was like, there's nothing about this. I don't like that. And then I thought I would be fine. But then as time kept going on, it was one of those things like, oh my God, I had cancer. And before 30 at that, like, so, and then like having kids on top of it, it was an experience. Not one that I ever want to do again.
No, it's not fun doing it again. I could tell you that much. No. But you brought up a good point that I want to transition into, is that comment that it's an old man's disease, because I got a similar, like I got almost the same comment,
like verbatim,
like almost verbatim, like, you're young, you're healthy, you're fit. You know, I don't see women like you here. You know, this is usually an old men. And I personally, I got pretty good care. I will admit, I was privileged enough to get really great care, but there was still that dismissal that I think impacts the surveillance part of it, right? Because it's like this idea that still can kind of reverberates through everything about, well, I'm still young and I'm still healthy. And I just want you to just explore that more, and like how just kind of having that dismissal had impacted you.
Honestly, it was like the first of what led to, well, the neurodivergence was where I first experienced it. Like, I think that was honestly the first time that I had realized like that the medical field was like that. But then when I thought back on it, I was like, did he lie to me? And I was like, or did he just like look at me like from the outside, not even knowing me? And he's like, oh, you're healthy. And I mean, and it's bizarre because like, you know, but for those that don't, chromophobe generally is slow growing. And I remember asking like I Googled like, what is the growth rate from what they know of chromophobe? And the math that I did, I likely had it since I was like 23, maybe ish, like from what they do know. And then like, I remember calling them, and it was maybe just about a week post-op. I thought I had one of my incisions was infected, and they were really dismissive then. And I just stopped and I thought about it, and I was like, I don't understand. Like, this is supposed to be one of the worst things that you can go through in life, is having cancer. And they were probably, I don't want to say they were the worst, because I'm sure there's worse doctors out there, but it definitely wasn't the experience that I would have thought. Like, it made me feel really crappy. Just like, it made me think like they obviously have never been through that or had somebody close to them go through that, because I don't think that they would have acted or treated me the way that they did. And then even afterwards, I'm pretty sure I still have that hernia from the surgery. And they dismissed me with that too. They're like, it's just scar tissue. But like that, and then having to be at home and like, not, it wasn't my husband, and it wasn't specific family. And I don't think even if they did, the people that did say things about like, oh, well, like it's out, it's gone, that type of thing. I don't think they ever meant those things in a harmful way, but hearing all that at that particular time in my life, I don't think I've ever quite like, and I've been through domestic violence and everything, and I still think even that wasn't as bad, but I don't think I ever felt more alone than I did with the dismissal and all of the things related to the cancer. Like I truly felt so alone.
And I think that is a common feeling among young survivors. Cancer is jarring no matter your age, but there are these preconceived notions. I think we can all admit there are preconceived notions about age and cancer, and when you do get cancer and when prevention starts. This is a conversation I was having with my partner Sam about our current rules and standards for preventative cancer care, and how it honestly starts too late, right? Like if we know,
it does,
if we know that there are young survivors and they are getting younger and younger, we are getting younger and younger, like why are we waiting until the 50s to do these surveillance? And it really comes down to that age factor.
You bringing that up is funny, because through all of this, and I love my oncologist now, I really do. I think she's great. But one thing that makes me so frustrated is because of my age, I want lifelong scans. Even if it's like even if it was like once a year or once every 2 years, like that would make my anxiety feel better. But she doesn't think it's necessary. And it's really frustrating. But then she ordered genetic testing, because the first time I had genetic testing done, I think it was, I don't remember if it was before. No, it was after I had the tumor removed, because I was told I didn't need an oncologist, but I ended up getting one anyway. And she ordered some genetic testing, but it was only like, I don't remember exactly how many, but I remember talking to you and some of our other friends that it wasn't as much as you guys had. And I was like, well, I don't like that either. So she did like the full gamut. She ran everything. And I think it's because a lot of people were like, oh, well, your immediate family doesn't have a huge history. And I'm like, that's because I don't have a lot of immediate family. Like I'm an only child. My mom's an only child. But when I got the genetic testing results back, they didn't find anything yet, but it was recommended that I call the breast cancer prevention center that they have there. And when I asked my oncologist about it, I was like, do you think that I should call now? And she goes, you don't need to start getting that until you're 40. And I'm like, I have a history of breast cancer in my family. Shouldn't I get that now? Especially because I've had one cancer young already. And as much as I love her, even she still has that, I don't know if it would be a bias, but the whole like, you're too young, you don't need it yet. And I'm like, but why?
Yeah.
Like I'm seeing so many people that I know, even if I don't know them like super personally, but so many people that I know that are under 50 or even under 40 that have had breast cancer. I actually know two personally that had breast cancer. Our small group that we know that were young and, got kidney cancer. And I'm just like, I don't understand. Like, I know the risk of the radiation and everything, but at the end of the day, like, I feel like that's so minimal compared to finding out late about a cancer or, I don't know.
But I think it definitely is an age bias in the medical industry. There are so many studies out there about age bias. There are so many studies out there about bias towards gender and race and ethnicity. And we need more training, I think. Like we need a lot more inclusivity training and just education among medical professionals, letting them know that we exist, right? Young survivors exist, and that you
say that, like saying that, hey, we exist, and like I hope nobody takes this the wrong way. I think you'll understand where I'm coming from. Childhood cancer is awful. It is like, I don't even have words for it as a mom. I could not even comprehend. It's awful for the older generation because they just might not have as much strength to fight it. But like, I almost feel like if you're not a child with cancer or not an older person with cancer, it almost feels like, well, you don't exist at all. If that makes sense.
No, that makes sense. I think that there's something very jarring about getting any type of illness or disease or condition at that kind of, I don't know what to call it, right? Like that middle, that middle age, it's not middle age, but it's like that just, I have that age range, right? That age range between like 20, 21 and like 42 or something, like, say, right? Like, because breast cancer starts at 40 in screening, colonoscopy start at like 45.
Yeah, they told me that I should start mine at 40, and I'm like, okay. I was like, but maybe we should do that just a little earlier.
Yeah, I think I don't know. For me, I think there needs to be some change in standard when it comes to younger survivors and their surveillance, right? Because there's
I also think they should take into account. Yeah, I think they should also take into account like our personal feelings, because like, sure, at a medical standpoint, if I hit, when I hit my 5 years, technically I'm supposed to be done with my scans. But if I have massive anxiety about ending that, I don't understand why it's such a big deal, to allow me to have some sort of peace of mind. Like, I feel like they expect me to be like, oh, you've made it 5 years, it's time to move on now.
No. Yeah, I agree with you there, because there's so many people, and that's one hard part about being part of support groups is that you see all of those stories where people after 20 years have a recurrence or have a new second, like a new primary. And granted, it's a percentage and it's, an extreme, right? That we're seeing in a support group. But the fact is that's a reality. And, I don't want to step on my soapbox about the medical industrial complex, right? Like I don't want to step on my soapbox, but with the research out there, the studies out there about about these biases and whatnot, there are so many ends up being misdiagnoses, treatment too late. And I think the more that young survivors speak out about their experience, especially in terms of treatment and like just in terms of everything, not, but particularly surveillance, I think the more, we can potentially change the perception. There was one thing that I remember I, and like just our group of friends had this discussion about being in an oncologist's office, right? And that view or treatment as if you are not the patient, but the child, right? And like you're just kind of dismissed or not treated with the same type of empathy or sympathy because there's this perception that you're there for someone else. I was in my oncologist office the other day. For our listeners, I am another year kidney cancer free. I wish I could say 3 years cancer free, but I'll get there at some point. But I'm another year cancer free of kidney cancer. And I did see a couple of younger people, and there was this part of me that was kind of relieved, right? That I wasn't just the only younger person there. I mean, I am going to be 41 next year, so I guess that's no longer young, but I did, first have cancer at 37.
Well, so you don't look like it, so you're, we'll take you into our,
that's just because of the blur and like the zoom. Like you see other photos, I'm like, oh, there's my age. But my whole point is, it's like, the young, like younger looking person. And it was just, there was a kind of a relief to not be the only one, right? Like there's, I think, a representation issue in the cancer survivorship community, and even the cancer patient community. Go on.
Oh yeah. Like, my husband's aunt, she had breast cancer, and, she's older, and just like, I literally, like you said, every single time that I go into the oncology office, Or like, so where I go to KU Medical, and so it's like a giant whole pavilion, like a whole building for it. It I don't see, like, it's all more older, like, honestly, I see more elderly than even like middle age. I might have seen like maybe one or two that might be closer in age to me since I've been going there. And I've been there almost 2 years now. And it's just like, at first it was kind of like laughable because I was like, oh my God, I'm the youngest one here. This is so weird. And then after a while, it's like, this isn't funny anymore. Like, I know, and I don't want to assume for everybody that is older, but I've spoken to a few older folks that have had cancer, older in age. And, they've all pretty much said that, when they were scared, they were like, well, I've lived most of my life, like my kids are grown, or, things of that nature. And I'm like, I don't know what that's like because my kids are little. Like,
Yes.
That's like, I haven't lived my life yet. Like, I haven't even been married 10 years. None of my children have graduated. Like, there's just so many things that I haven't done or experienced yet in life. And like, it's a really unique thing to have to think about, like, well, if it comes back, or like at the time. And for those that don't know, I did not have clean margins for my surgery. So what that means is there very well could be cancer still in my body. When they remove the tumor, there's supposed to be like a margin around it that is cancer-free cells and everything. And mine was not. So like, yeah, I may have, am I almost 3 years now, cancer-free? But like, what if I'm not next time? My kids are still young. My littlest just turned 4. And, it's a unique thing because like, I have to sit here and wonder, like, if it ever comes back, am I going to get to watch my kids grow up?
Exactly. And I understand, and I know you do too. Like, I understand this want to, comfort us, to look at the positive, for us to be grateful, to not, be gripped by fear. But, in my case, I mean, we were both told the same thing, like, we'll live long lives. It will be rare. You won't get it again. And that may be true, but that doesn't mean another cancer won't come into your life. Right. And you look at me.
We're still young. There's plenty of time.
There's still young. There's plenty of time. And, I had cancer twice. I had 2 different types of cancer. I don't know what my body's going to do to me. And like, that is a reality, and a hard reality that I'm going to have to live with for the rest of my life, that everyone is saying that I have to live. Right. And like, my son is 8, and I want to be able to watch him grow up. Like, I want to be able to see, like, there's no guarantee. And they could, I don't know if you've heard this, but I've heard people say, or like through others say, well, you could go outside and get hit by a car. And
yeah, sure, you could,
but it's like, cancer is a different experience. You could walk out and get hit by a car at 82, right? Like, it can happen. That could have happened when you were a kid.
I feel like
it could happen. Yeah.
I feel like, I don't know, just to me, it feels like the concept, like, that they're saying, like, oh, well, you could, walk outside and get hit by a car. I feel like that's more likely to happen than, like, especially like our cancer, like chromophobe is rare, or, well, they say it's rare. I don't know. But like, I feel like I'm probably more likely to get hit by a car. So, the idea of like, hey, cancer probably isn't going to come back, but it might. Like, I got one rare cancer already. Like, the word rare or uncommon doesn't mean anything to me. And then like, there's, not that I'm aware of any official studies or like anything like saying, yes, like the type of the second cancer that you got is directly related, but there's so many like things pointing that they are connected. And like, you and I, like, I feel like you and I have a special bond in it because we were both stage 1, and we understand the whole, especially being younger, the whole, oh, well, it was just stage 1, like, you're fine. It's not, it's not as bad as it could have been, type of thing. But then knowing that you did in fact get another cancer, and that there's some evidence out there pointing that they could be related, like, that scared the crap out of me. Yeah, like, when I heard that, like, not only was I so upset for you and like worried because you're my friend, but then it got me thinking in kind of a crappy place again, that like, oh my God, that really can happen. And then learning more about it, I'm like, can I just get a whole body scan, please? Like, I'm only 31. Like,
Yeah.
one full body scan's not going to hurt me that much. Like, just so I have some peace of mind that, hey, there's not some weird maybe tumor thing floating around somewhere, you know. It's just, and I just don't know how to explain it, because like you said, so many people are like, oh, well, don't focus on like the what ifs, the negatives, but like, what else am I supposed to do? Like, I was 27. I was not supposed to have cancer at 27.
Yeah, not supposed to have cancer at all, right?
Yeah.
Like, it's just, and I think
Well, yeah.
yeah, right. And I think that's the thing there. So I want to make it clear, right, for our listeners, that we're not doing this like age against age kind of thing, right? It's again more about like representation and misperceptions around age and cancer. And there was a point to that, but you know, it's something that comes up often that I have conversations with.
I think it's just to say that, like, we're not trying to say like, no, I think we were just trying to say like, it's not that we're trying to pit ages or anything. It's not worse to have it as an older person, a younger person. It's just, there are unique things that aren't discussed, you know, in our particular age area. And we would like people to be more understanding and aware of that.
Yeah, no, what I was also going to say is like, you know, there's this concept of dialectical thinking, and it's like you can be worried and grateful at the same time. And I think in my experience, particularly when you're a younger survivor, it seems like you know, there's this pressure to not have that, right? It's like there's this pressure to just be grateful. Like you have to fit into this like warrior archetype. And I might have mentioned that on another podcast episode, but it's so prevalent, and it's not necessarily from other cancer survivors, right? Like we all internalize our messages, so we might perpetuate those messages, we all internalize them, but it's often from people who have not had any experience with cancer in any way. And
for sure,
it's just all we're asking for, again, is that representation, that understanding, that empathy, that it's very jarring when you're young. It's jarring at any age, but there again, there's a unique experience when you have not lived that full life and your kid's not 45 or 55, right? You know what I'm saying? Like it scares me, and I'm grateful for my prognoses. But as you said, you know, the term rare means nothing. Thyroid cancer is not exactly, while it might be a common, one of the common cancers for women, it's not exactly a common cancer. There's like less than 50,000 cases a year in the US. So it's not exactly common. So whenever doctors say it's common, I'm like, do we have the same definition of common? Like, do we have this? I don't think we do.
It's so funny to me because like, and I've made my oncologist laugh when I first met her, because, you know, she's like, you know, oh, you got a rare cancer. You know, I don't see a whole lot of chromophobe coming in here.
I got the same thing.
Yeah. And I was just like that. And I just kind of chuckled, and she goes, you know, wondering what I was laughing at. And I'm like, I just don't find rare to be a thing anymore. Cause like so many times, oh, well, you have this that's rare, or like POTS. I have POTS. And they're like, oh, it's all rare. It's rare. It's rare. So it's rare that it's going to come back. And I'm like, have you met me though? Like, I seem to have a magnet for rare things. And then another thing I was going to add in is, besides like, this age, having to wonder, like, am I going to leave my children my mother before they're grown? It also was a thought that my mother is like, my father and I are estranged, but I'm very close with my mom, and my mom is still alive. And as a parent myself, I can't fathom watching your child go before you, because that's not how it's supposed to work, you know. And so like I also had that like, oh my God, what's going to happen to my mom, you know, if the worst should happen with me, you know. And it's just, there's just so many things that you don't think about. So
just quickly for our audience, can you explain what POTS is?
So POTS is short for postural orthostatic tachycardia syndrome. a lot of folks think that it's just a heart issue, but it's more of an autonomic nervous system issue. I do believe, I don't know if they've officially done it. I think they are starting to classify it as, what is that word? Fibromyalgia is under it. Autoimmune is what I was going to say. Because, so like for me, a lot of my symptoms are like, I don't tolerate heat and cold very well. I get blood pooling. So like when I change positions a lot, I get super, super dizzy and lightheaded. Many people with POTS pass out. I don't, or have not yet, thankfully, but it's a whole bunch of things. You can take like extra electrolytes and compression garments, which are so attractive. So yeah, and that's something that comes with like neurodivergence. It's a comorbidity. And then I also have, I'm pretty sure, EDS, which is Ehlers-Danlos syndrome, which is a connective tissue disorder. And they say those are also rare. Yeah. So that's probably why a lot of people are like, oh, she says rare doesn't mean anything. But that's just why, because over the course of the last 5 years, I've discovered so many different health things that I'm just like, none of this rare means anything to me anymore.
Yeah, no, I completely understand that. I did want to go back to something you had said in terms of like that feeling, right, of, you know, what if, and I think part of it too for anyone is learning how to manage it, right? Like learning how to manage those moments of like, you know, shadow thinking, if you will, because we all have them. But I think this transcends age. But I think there is this need for us to accept that those thoughts exist, you know, like we can't ignore the fact that we do have those thoughts, because I think the more we ignore it, we're going to hit that wall. We're going to hit that point where we break down. But if we could like sit there and acknowledge we have these fears, we can sit with them, we can comfort them, and then we could put it aside and like go about our day. You know, I think ignoring the reality just does us more damage. And then when we have the people around us, you know, also ignoring that reality and dismissing that reality and saying things like, well, you know, an old man's disease. It's like, clearly it's not an old man's disease. Yeah. Right. Clearly it happens to women too. Clearly it happens to younger people too. You know, you can't make these sweeping generalizations based on limited research. It's, you know, we know that particularly chromophobe, there are other rare types of kidney cancer that are also very under research, which is why KCA is doing the amazing work they're doing with their grants and funding that research. But, you know, we don't know anything about chromophobe. Like we don't know its profile very well. We don't know.
It's not like breast cancer. And this is not to say that like breast cancer is not as bad and they don't deserve all the funding and all the things, because they absolutely do. But like so much is known about breast cancer that like every single person that I know that's ever had breast cancer, they went in and they were told, okay, this is what your stage and grade and all this stuff is, your what subtype you have. This is exactly your course of treatment. It's not like that for ours, you know. And and then like going back to what you said about the what ifs, I think the recovery of the cancer, it wasn't great, but it wasn't as awful as, you know, what I know some other people have experienced. But I definitely think the mental toll has been way worse. Like, and what you were saying about having to like, you know, sit with it, but then not let it consume you basically is really hard, especially when you already struggle with depression and anxiety. And then you add cancer into it, you know. And so like, I know there's probably a bunch of people out there that are like, oh, well, why does she keep bringing up the cancer? Like, that was how many years ago? She's cancer free. It's not back. Like, get over it. You know, you're fine. You're healthy. Like, but that's what I thought when they said that I had cancer. And then like, it also makes me think like, if I hadn't had a baby that was so big that gave me a hernia to have to, you know, have the imaging, how much longer would I have had it? You know, like when it was discovered, would I have been stage 2? Would I have been stage 3? Would it have been stage 4? Would it have been too late? Yeah. You know, there's so many what ifs, and like just looking back on it, I don't know, it's very easy, I guess, to get consumed with it. And I mean, I'm sure there's some people out there that maybe aren't affected as much mentally, you know, with a cancer diagnosis that they've had. And that's fantastic. And I'm so happy for them. But I don't feel like that's the reality for most people. I feel like it's one of those things where we're expected, especially our generation, to pull ourselves up by our bootstraps.
Yeah.
And just, keep trudging forward. And so there's really not a lot of room to talk about it.
Yeah, I would agree. Again, and it goes back to that you're so young, you're going to live a healthy life. Just be grateful. What has it been like for you trying to find other people who share your experience?
I feel like, I feel like I got very lucky. And I say that because I was just like, I don't even remember what I was doing one day, but somehow I found Catherine's shirt. No, it was her story. I think it was, for those that don't know, a friend of ours, Catherine, she was originally diagnosed stage 1, I believe. And then just a few months later, they were like, oh no.
No, I think it was stage 3. Yeah. Yeah.
Okay. Well, she had one stage initially, and then it was later found out that it was worse. And I found her story, and she has the same cancer that I had. And somehow I found it, and it brought me to, I think it brought me to some sort of Facebook group.
Yeah.
And then that's kind of how I found everybody. And so I feel like I kind of got lucky in that sense. But then also as a photographer, I'm in like a ton of, professional photography groups. And my specialty is documentary photography. So for those that don't know, I don't pose people. I don't do props. It's real life, like honest, you guys as you are type of stuff. And that's a smaller group in the photography world. And there was a mentoring program that I signed up for. And somebody else that signed up for it as well was currently going through chemo for breast cancer. She lives in Australia. Shout out, Kat, if you watch this. But she's in her 30s as well. And she's got 2 young kids just like me. And so we ended up forming such a really close bond because we were in the mentoring. I didn't understand a lot of what she was experiencing because she had, a double mastectomy. She decided on a flat closure. She, had chemo and the radiation and just all the things. I didn't experience that, but I was very lucky that, and if I'm not mistaken, and she can yell at me later if I get this wrong, I also believe she was stage 1, but she just understood so much of like how I felt, and I know our little group has talked about it in a sense that like, we don't get chemo, so we don't look sick. We don't look like we had cancer. We, have all my hair, and meanwhile she had none. And like, you can't physically see unless I lift my shirt up. Whereas with her, when you see her, you immediately know. And it was just, we bonded very well also over the fact that, we see all these commercials for like happy cancer survivors and they're all smiles. And I'm like, that is so not the reality. But so I'm very lucky because I just happened to find our little group and then another person. I don't know a whole lot of people other than that, but I will say at least like the groups that I'm in on Facebook seem to be nice. I think I am in a young adult cancer group. I'm not as active in that one as much, but I know there's one that exists. And so I'm sure I could possibly find more people, but again, and I just want to keep saying, I think I'm very lucky. I don't want a lot of people out there to think that, oh, I'm going to find like some of my best friends because like my kids call my friend Auntie Cat, it's not a very common thing. There is support out there, but I'm just very thankful that, things played out the way they did. And I found you guys and I found her because there's definitely times, whether it was with you guys or with her, I know you're like your partner or your spouse is supposed to be your go-to person, but it's kind of really hard for them to understand because they've never experienced it. They don't get it.
Yeah. And then
I was very lucky.
Yeah, I would agree with, being lucky to find you guys and be able to like turn to you because there's that collective cancer experience. And I won't go through like the statistics in this one. So because people should listen to the one on managing emotions, but it's like, I think the statistics are around more than half of cancer patients and cancer survivors have some mental health concerns related to their cancer, but only 5% actually get treatment. So there is a need there, right? Like there is, despite, perceptions and how we are represented in the media and whatnot, you know, there is a very big need there. So we are very lucky that we've been able to find people that we could turn to and kind of latch on to that like collective cancer experience, because I think, you know, and not everyone who is young is a parent. Not everyone who's young wants to be a parent.
Right.
So we're obviously speaking from the young parent perspective, but you know, there is that, you know, we want the rest of our life. And we want to make sure that the rest of our life is healthy. We don't want to just assume it's healthy. We don't want to just be like, okay, we don't have to do these tests because you say so, you know? And then
because the last time we did that, look where it got us.
Yeah, it's all about advocating for ourselves. And maybe that's our call of act. No, that is our call to action to other younger survivors and just survivors in general of rare diseases, under-researched diseases, ignored diseases, to make more noise, right? The only way we can make change is if we make noise.
They will listen eventually.
Yeah. We just have to make that noise. But you bring up a good point, you know, that what if question too. It's not necessarily just about us. It's about our friends who found it at a later stage. And it's just a different what if, right? So like for us is, what if it comes back? Will I have that treatment? And for them, it's more of like, what if it's not responding to this treatment? Do I have other treatment? Right. But it is still at the base, you know, a what if that needs to be asked. And I think that's the other thing too, right? It's when we ask that question of what if it comes back, it's not a woe is me kind of mentality. It's a question that needs an answer, and we need prevention or active surveillance or something, right?
Yeah.
Like, it's not just this, oh, you're worried for nothing thing. It's like, no, we have a worst case scenario. Like they tell you this
there was a time in our lives where we were never worried about anything. And now we have to be worried, so.
Exactly. It's like they talk about this in business all the time, you know, about always planning for the worst case scenario. Like whenever you're doing any type of projection planning, you always have to plan for that worst case scenario. So why is that not applied to us? Like, let us prepare for the worst case scenario. So what are our options?
Because then it can't be like, it's not always that bad then. Like, it's funny that you say that, because like and I don't know if this is like a trauma response, but my whole life I've always been like, prepare for the worst and hope for the best.
Yeah.
Because at least if you prepare for like as bad as it could possibly be, you're at least prepared for that, and it can only get better from there, right? You know what I mean?
Yeah. It's not the assumption that the worst is going to happen, right? And I think that's the thing. It goes again back to misconceptions and other people's own like beliefs and bias, is that like asking this question is not hoping for the worst case scenario. It's not saying the worst case scenario will happen, but it's keeping yourself prepared for when it will happen. Because again, neither one of us grew up thinking we will have cancer. You know, neither one of us, you know, had thought that would happen, and it did. And so it's like, well, now we know. And so let's find a way to prepare later on. We can't just keep ignoring or dismissing. Like it's that short, and I'm speaking in corporate terms because that's what I do from a day job, but it's that short-term thinking that just ends up screwing you in the end. And it's like, if we could just make noise and change the system where it's not so rooted in short-term thinking and it's more holistic and long-term view and preventative versus reactionary, we could have so much a healthier. And when I say healthier, I don't mean like go to the gym, jump on like 24-inch boxes and then do a burpee. I mean, just, you know, less cancer and less autoimmune diseases and, you know, less COVID, if you will, right? So we have about a minute left. I just want to open the floor to you to talk about anything that maybe we didn't touch on, like a point that you want to get across.
I guess the biggest thing that I would say is for anybody, whether it's like you're young and it's kidney cancer or just anybody that's younger going through any type of cancer, the one thing that I would encourage the most is finding whatever outlet is going to work for you to help you work through the emotions and let yourself feel them. I am not doing it as much as I would have, but as a photographer, I started taking self-portraits. And I can say that my friend Kat, she obviously, because she had surgeries and had much more to document, she documented so much more of her cancer and through her cancer journey that I was able to. And I can say that 1,000%, it was a huge help for both of us. So whether it's, even if it's just your iPhone, take pictures of yourself, write about it. Like, even if you're not good with words, just like jot it down, paint, whatever would work for you, find something just for you to do. That's an outlet to let yourself feel all the things.
Thank you so much for joining us, Melissa. It was, as always, a pleasure to chat with you. And I
know one of these days we'll have to do it personally, but no,
yes.
Thank you guys for having me on. It's always, kind of like a little bit of an honor, if you will, to be able to talk about it. I feel kind of like a celebrity almost.
Well, you'll be a celebrity after this.
Thank you guys so much.
Thank you.
We hope you enjoyed this episode of Kidney Cancer Unfiltered, brought to you by the Kidney Cancer Association. Please subscribe wherever you listen to podcasts to get episodes weekly. And if you like the show, we'd love it if you left a review. It really helps others find us. Thanks again for listening. For more information about kidney cancer, visit the Kidney Cancer Association online at kidneycancer.org.